Hello, future doctors. I'm Dr. Ask, turning stress into success, and this ain't your boring textbook breakdown. Let's get clinical but chill. Today, we are diving into a high yield topic that confuses a lot of students Megalencephaly. One MCQ, one story, and everything you need to know about this topic is here in a minute. If you are preparing for a FMGE or NEET exam and want more clear and chill explanation, just go ahead and hit that subscribe button so you don't miss a thing. Okay, so here is a FMGE-style MCQ. A 2-month-old baby present with macrocephaly, hypotonia, seizure and delayed milestone. MRI shows increased white matter and enlarged cerebral hemisphere. So what's the most likely diagnosis? Option A, hydrocephalus. B, megalencephaly. C, microcephaly. And D, craniotabs. Think for a second. Yeah, the answer is megalencephaly. Let me tell you why. Okay, meet baby Asha. At 2 months, her family noticed her head was huge. Her grandma said she must be very intelligent. But soon she started having seizures and couldn't hold her neck and wasn't smiling. And then MRI showed that it wasn't fluid, her brain tissue itself was enlarged. So guys, this is called megalencephaly, when the brain is abnormally large and not just the skull. Now, here is where most people get confused. You need to clearly distinguish macrocephaly from megalencephaly. Macrocephaly means the head circumference is large. It could be due to bone, fluid or anything. But megalencephaly means the brain itself is overgrown. So remember guys, big head maybe, but big brain, that's megalencephaly. Let's classify it. There are 3 main types of megalencephaly: anatomic, metabolic and idiopathic. Anatomic is caused by genetic syndromes like Sotos or Patent mutation, where metabolic is from storage disorders like Canavan, Alexander, Tay-Sachs or Sandoff. And then idiopathic, which is the most common, where it runs in families benign familial megalencephaly. And these are favorite exam areas guys, so pay attention to the buzzwords coming next. Alright guys, let's go high yield rapid fire mode. First, Tay-Sachs disease, which is seen in Ashkenazi Jewish population. They present with seizure, regression and that classic cherry red spot on the retina. Sandoff disease looks like just like Tay-Sachs but occurs in non-Jewish ethnics too. So if the stem says Tay-Sachs like but the ethnicity doesn't match, think Sandoff. Canavan disease, think of a spongy brain. This leukodystrophy shows spongy degeneration of white matter, common in Ashkenazi Jews again. And Alexander disease, here the buzzword is Rosenthal fibers. Yeah, these are the eosinophilic inclusion in astrocytes, seen on biopsy or pathology questions. And then here comes a classic FMG MCQs, Fragile X syndrome. It presents with macrocephaly, autism and yes, macroorchidism, which means large testicles, especially after puberty. Familial megalencephaly, this one is benign and it is the most common one. The baby looks big-brained but has normal milestone and you will find a family history of large heads. So every time you get a megalencephaly case, ask this first: is this a disease or just the family gene? That's how you win the MCQ. So let's clear the confusion now. What are the main differentials? Hydrocephalus, macrocephaly, hemimegalencephaly and then brain tumor. So what is hydrocephalus? It is a increased CSF and there is a big ventricles, where macrocephaly is the skull is big but not necessarily brain. Hemimegalencephaly is one hemisphere is enlarged, where the brain tumor is a focal growth and not generalized brain overgrowth. So again, megalencephaly means big brain, not fluid or mass. So how do we confirm it? Step 1, MRI brain, which shows enlarged parenchyma. Step 2, genetic testing for P10, Sotos, Fragile X. And step 3 is metabolic screening for disease like Canavan, Tay-Sachs. So for management, there is no reversal, it's supportive. control seizures, provide yearly developmental therapy, and always offer genetic counseling. Okay, doctors, let's lock this in with a recap quiz. Try to answer quickly. First question, cherry red spot plus seizure, what do you think? Then autism plus macrocephaly plus big testicles. And then spongy white matters? Yes, then one hemisphere big. I hope you got the answers. And that's your quick crash course on Megalencephaly. If this helped, do like, share and subscribe. It really supports the channel. Comment below what topic you want next, and I am here to make your preparation stress-free and solid. Study smart in doctor style. Thank you. Bye-bye.